One of the most common misconceptions we find in dentistry is that most people think all white fillings are the same. This is far from the truth. There are fundamentally two types of white fillings, porcelain and resin. We often compare the difference between porcelain fillings and resin fillings like the difference between your plastic picnic plates versus your fine china dinnerware. They're like chalk and cheese, totally different products. In terms of terminology, plastic white fillings can be referred to as composite or resin. Porcelain fillings are often called inlays, ceramic or Cerec restorations. Both types of restorations utilise the same blue light that is used to set hard the cement material. The resin is placed in soft and set hard with the light, whereas the porcelain restoration is a hard, prefabricated filling that is bonded into the cavity. When a filling is on the larger side, requiring corners or what are termed as cusp replacements, we always recommend porcelain reconstruction of the tooth to ensure that you are not back in the dental chair fixing the same tooth again anytime soon. The porcelain filling is no doubt more expensive, but when you consider you may have to replace a plastic resin filling over and over, the price differential may prove to be a lot less than first envisaged. At Smile Solutions, both options of white fillings are readily available. It's a matter of working out with you which option best suits your expectations and budget.
I would like to introduce you to Dr. Torsten Danheimer, who is considered by his peers at Smile Solutions to be an expert in the field of Cerec dentistry. How are you, Dr. Torsten?
Very well, and you?
Very well, thank you. So tell me, I believe you've been using this technology for some time and you've done quite a lot of fillings.
Yes, I have. I've started using this technology in 2001, and since then I've probably done around 5,000 plus of these restorations.
And I believe there's lots of other dentists here that also do the same type of work.
I'm lucky to be with Smile Solutions, where we have a very large group of specialists and other Cerec users as well in practice. Yeah, we come together once a week to discuss cases and really further our knowledge and share whatever information we've got with each other.
And tell me, what's the difference between a Cerec porcelain filling and a composite resin filling?
Cerec filling is obviously out of porcelain, right, which is very hard, and the resin fillings are normally out of plastic. For bigger restorations of the back of the mouth, we normally use porcelain, which is quite strong, and for smaller fillings, like smaller cavities in the front of the mouth, we normally use plastic or resin fillings. The removing or replacing old amalgam fillings, Cerec is probably one of the best choices to use there.
And what are the benefits and advantages of having a Cerec porcelain filling as opposed to a normal white filling?
It's a single visit procedure, so the nice thing is we numb you up once, it gets done in 90 minutes and you're out the door and it's all done. We used to take impressions, send it to the lab, get it back, so it's at least 2 weeks out of your time and 2 visits, so it makes a lot more sense, especially with people nowadays that don't have the time anymore. The other thing is it's a lot more superior, it's a lot harder, it's a lot more natural looking than resin. It blends in very well with the surrounding tooth structures. Also, another thing is conservation of healthy tooth structure. With modern bonding techniques that we use today, there is no need to remove a lot of tooth structure. We just remove what's necessary and replace that with a ceramic inlay.
Torsten, can you run through what happens in a procedure?
First of all, we do examination, we take x-rays, we need to see what needs to be done. What we do is we numb the patient up. We remove all the decay and the filling that needs to be replaced. Once that's done, we clean up the margin and everything. We then take an infrared camera and take photos of the tooth. So we've got an intraoral camera, which is a 3D camera, and we put it on the tooth and actually take the pictures. And you can see the pictures coming up on the screen on the Cerec unit, and that basically forms the model. Yeah. From that model, we then actually design your new restoration with the help of the computer. And the nice thing about that is we can actually change and make the filling bigger, make it any shape you want, until we're happy, until the patient's happy, and then we actually then put in a block of ceramic into the milling unit, which is either in the room or somewhere next door, and start milling this restoration out of the block.
And then it comes out exactly the right size, yeah?
It comes out exactly the right size, and all we do is we just polish it, make it all nice and shiny, glue it in, check the bite that it's all good, fits well, and there we go.
Well, thank you so much for all that information, Torsten.
It was great chatting to you.